This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you.
This is going to be Chapter 6, Abdominal and Genitourinary Trauma. Key concepts. Upon completion of this chapter, you will understand abdominal trauma that occurs in one of three cavities, how injuries in solid organs tend to cause hemorrhagic shock, the tamponade effect of subcapsular bleeding, referred pain associated with solid organ bleeding. Overview. Abdominal trauma occurs regularly, multi-trauma and as multi-systems trauma and as isolated trauma. May not be apparent to your assessment immediately. Abdominal structures have mobility and stretchability. The peritoneal cavity can accommodate up to 3 liters of blood without distension. Spinal cord injuries increase a higher incidence of intra-abdominal injury. The challenge of this is to appropriately treat a hypotensive patient with a spinal cord injury and a possible intra-abdominal injury simultaneously. And then intra-abdominal injuries maintain a high index of suspicion. They have multiple organs in there that will allow bleeding. Chief concern, abdominal injuries. They're caused by blunt or penetrating trauma. And on the penetrating trauma, we'll see things like knife wounds, bullet wounds, shrapnel, etc. On the blunt trauma, force over a large area. An example of this would be a vehicle crash. Just because someone has penetrating trauma to an isolated spot on the abdomen does not mean that it's going to be limited to the abdomen. It depends on the object's trajectory, the speed, the mass, and secondary collisions with any kind of bony structures that might be inside. On the blunt force end of it, it may involve the entire torso and divided into direct forces to the body and deceleration forces within the body. So whenever blunt force occurs to the torso, it can cause shearing force inside, and cavitation wave depending on how much force it entered into the body, and shear and tear organs. Abdominal injuries can be divided into solid organ injuries and hollow organ injuries, vascular injuries, and genitourinary system injuries. Solid organ injury. Highly vascular organs, which are rich in arterial blood supply, and they give us a potentially significant blood loss in a very short period of time. Solid organs, like the liver, spleen, pancreas, and kidneys. The liver itself is composed of 4 lobes and a total of 8 segments, and each of them have their own blood supply, very vascular area. The spleen is one of the body's filters located in the left upper quadrant, just lying inferior to the diaphragm or just below it. And it also has a very rich blood supply. The pancreas is in the retroperitoneal space, located posterior to the stomach or behind it, and anterior to the abdominal aorta. So it's jammed in between the aorta and the stomach. Solid organ kidneys also in the retroperitoneal area, but not as well protected as the spleen. Solid organ injury grading. The American Association for Surgery of Trauma, based on the size of the laceration and hematoma or the presence of vascular injuries, is how they associate that or grade it. This is figure 6.1 in your book, retroperitoneal structures that are located behind the parietal perineum rather than within the peritoneal cavity. And we have various structures here, like a section of the duodenum, kidneys, pancreas, some of the colon, and some of the descending colon, the rectum, are all in the retroperitoneal area. So if you have shear force in this area, you can damage any of these. The kidneys are attached very vascularly to the descending aorta. So just keep that in mind. You can have shear force on that vessel and cause a lot of retroperitoneal bleeding in a very quick amount of time. This is figure 6.3, normal ultrasound image of a right upper quadrant compared with an image of a right upper quadrant with free fluid. So A, normal, and B, not so normal. This free fluid is blood. And since this is located in the right upper quadrant, this would be a fast ultrasound of an abdomen with a liver lac. Figure 6.5, the ureter is susceptible to injury as it crosses the pelvic rim, and any kind of pelvic fracture at all could provide damage to this ureter. Also bladder as well. Hollow viscous and diaphragmatic injury. Hollow viscous injury is a generic term used to describe any number of injuries that can occur to the hollow abdominal organs. Occurs more often with penetrating trauma and is quite rare in blunt trauma. Associated with other injuries though, like solid organ injuries, fractures of the lumbar spine, lower ribs, and lower extremities and pelvis. Leakage from a hollow viscous rupture spills into the peritoneal cavity, and this can cause significant irritation and infection of the peritoneum. This is figure 6.7, and in a diaphragmatic rupture, the abdominal contents compress the thoracic content. So we've had a rupture, and essentially the intestines spill into the thoracic cavity. This can cause mediastinal shifts, lower cardiac output, decreased surface area for breathing. A lot of things can go wrong in a very short amount of time if this occurs. Vascular injuries. The abdominal vascular injuries can be devastating and essentially generate a life-threatening abdominal hemorrhage. And examples of this would be renal artery, aorta, also the inferior vena cava. Genitourinary injury causes penetrating trauma to any portion of the abdomen as well as the buttocks, upper legs. This can potentially involve the genitourinary system. Blunt trauma typically affects the kidneys, urinary bladder, and external genitalia due to their accessibility location and the location of these structures. Genitourinary injuries include the kidneys, and this is discussed in a section, the later section of solid organ injuries. The ureters, and the ureters, urinary bladder, and urethra most commonly occur from a pelvic fracture. External genitalia and reproductive organs from straddle injuries, from blunt force injury. And then the reproductive organs also can be injured due to self-mutilation or an assault. History, initial impression, observe the scene and damage, and try to elicit any kind of mechanism of injury, ask patients and bystanders on this. Ask about abdominal pain, obtain additional information, and this would be a sample OPQRST, location, quality, radiation, does anything make it better or worse, recurrence of the pain and any kind of factors that make it worse, severity and time of onset. Inquire about any other recent injuries, even minor may be significant. Be aware of pain referral patterns. So a lot of times we get referred pain because there's not as much neural tissue in that area, or whenever it is getting information that there is pain there, it's perceived by the patient as being from a very large area. So they will get referred pain. An example of this would be chest pain that refers up into your jaw and down into your arm. Examination. Perform rapid primary assessment and address any type of life-threatening conditions. We should obtain a set of vital signs and perform a head-to-toe examination. The abdominal assessment should be done through inspection, auscultation, palpation, and percussion. Assess any type of exposed abdominal wounds, lacerations, and bruised areas that may indicate the presence of any kind of underlying injury. Multi-system trauma, the auscultation version of the abdomen has limited usefulness. An example of this, we may not hear abdominal sounds or bowel sounds due to trauma to the area. Palpation should always start with the quadrant furthest away from the location of pain and then work towards it. This is figure 610 and examples of abdominal findings upon inspection. A is a seatbelt sign. B is an abdominal gunshot wound. And C is an abdominal stab wound. Now the stab wounds, let's say that this was the surface of the skin. Depending on how long the knife was this long. It could cause damage to any of the organs in this area here. On assessment, abdominal injuries, they're sometimes difficult to detect because of a variety of reasons. Distracting other painful injuries may mask the pain. Altered mental status can blunt the sensation. Palpation during the physical exam may also produce abdominal tenderness. Multi-trauma setting, the inner abdominal injury, most common cause of hypotension is from an inner abdominal bleed. Treatment. Initial treatment priorities are going to be ABCs, or treating the airway, breathing, and circulation issues. An abdominal injury may be the source of the hypotension, requiring treatment of hemorrhagic shock, or even requiring only general supportive care treatment en route. The setting of the poor perfusion, apply high flow oxygen to the patient in high concentrations, and again treat for shock. Patient that is stable, consider other treatment as appropriate. An example of this would be analgesia for the pain. Vital signs, observe them very closely during transport. Abdominal trauma, life-threatening internal hemorrhage risk in all your patients. Hemorrhagic shock symptoms are going to be things like widening pulse pressure and unexplained tachycardia with normal pulse pressure. Widening pulse pressure is a widening of the systolic and diastolic numbers. Disposition. Transport to the closest, most appropriate facility with patients that have hypotension with abdominal trauma. Most likely will require emergency intervention like surgery. Transport to the closest trauma center would be suspected intra-abdominal hemorrhage, positive free-floating peritoneal or pelvic fluid in case you do have the ability to look at a fast ultrasound. And then to a community level hospital, transport to a community hospital, isolated injury, normal vital signs, and a stable patient. In conclusion, abdominal injuries are challenging. Isolated injuries and multi-system trauma may be hidden beneath the skin. Paramedic must maintain a high suspicion. Proper assessment and management of these patients are critical. References are taken from Myers Professional Paramedic Volume 3, Trauma Care and EMS Operations of Del Mar Learning. And if you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, or at smith@redlandscc.edu, or 405-219-7613. Thank you.